at one of the Independence houses here in Lincoln, Nebraska. I'm here with Marsha, the owner. Hi, Marsha.
Hi.
Can you tell me a little bit about your background? How long have you been involved with Alzheimer's and dementia patients?
Well, for probably close to 30 years. I've been an RN all my life and involved with elderly most of my career. And probably what I noticed is as I worked with the elderly, and at the time I started working, there wasn't really many assisted livings. They were just coming into vogue. And there was a big difference between being in your home and actually being in a skilled facility, because that was your choice at that time. So that's why I got the thought and the concept, okay, why don't I do this? Get a nice home that's a very warm, loving home, and license that as assisted living and for memory care. So that's how it got started, in a secure environment and keeping it small, because people with dementia have a problem when they get in large groups. They just don't handle that. They get irritated, they will regress and go hide. They just don't like it at all. They can't function very well.
This is the original house that we're in.
This is the original house, and this opened in the mid-90s. So it's been a little over 20 years ago that I opened this in Lincoln. When I started, most of the facilities were skilled nursing, which is not very home-like, expensive. And what I noticed is a lot of people with memory care don't have a lot of health issues besides their dementia. Some of them are what you'd call healthy as a horse. They just really are just slowly losing their mind and their memory. So the people that need more emotional support or activities, we have a full-time activity director every day. I mean, they're not 24/7, but we're 7 days a week, keeping people engaged, and that's important. So the socialization you get, plus the loving care, and we can provide more one-on-one care, because as you see, this is a small environment, and that's what's important.
So what sort of range of ages are you looking at that are coming through here?
We probably have residents from age 60 up to 100. And now that the baby boomers are coming through, we see more people in their 60s. But we have quite a variety of age groups.
So somebody who might be out there, either they're concerned this might be happening to them, or maybe they have family that are concerned about this. What is the first step that they need to do to get assistance?
Well, what I would say is I encourage people to go to their doctor, get a thorough checkup. And it might be your own doctor. There's certainly assessment centers, because you need to find out, is there other causes why you might be having memory issues? Maybe you have a bad infection. Maybe you need to clear up a bad UTI. I mean, it could be something like that. So find out, is there other conditions and what shape are you in? Do a whole head-to-toe, as a nurse, a head-to-toe assessment, and make sure what you're really got going on with that person. Most physicians don't do that much as far as tests go. A lot of it's based on symptoms. You know, what do you see? Are they slowly losing their memory? Do they have behaviors that you notice? They're getting aggressive, or their personality has changed. They used to be an introvert, all of a sudden they're an extrovert. It's like, what happened here? You know, what kind of things are going on? Their routines, they forget how to do routines. Used to be a great cook, now they can't even remember how to cook. You might see they can't even use a stove anymore. So you start looking for general signs and symptoms like that.
Some people, I imagine, maybe they're trying to do this, manage it within their home.
And a lot do.
What advice do you have for them to get assistance or resources that might be available for them?
Well, we get calls like that every day. And we do have support groups, and that's a huge plus, because people need to talk to other people that have the same issues and the same problems. And so we encourage them to come to our support groups. The other thing is they certainly should start looking ahead. Denial is a big issue. They put it off until a crisis happens. But the best would be is to plan ahead. You know, it's not going to go away. So you need to look at what are my options, what's best and fits my family and my comfort, and look around and make sure you've picked the best choice for your family.
And maybe it is denial. Are there other things you see are factors that are the causes for people not getting assistance?
Well, some of it could be financial. They just can't afford it. And some, I think in that age group of 80, 90-year-olds, you hear all the time, my spouse said they would never put me in a facility. I would always be at home. They will take care of me. And some spouses will try until their health declines and they just can't do it anymore. Or the kids, maybe the one spouse has already passed away. The kids have a busy life and they really can't do that either. But a lot of people will try in their home for quite a period of time, and then when it comes to the end, they really need assistance.
So if we have viewers that want information on independence houses or support groups or other resources in town that involving dementia, where can they go?
Well, we have a website, www.theindependencehouses.com, or they can call us, 402-475-7755. I will say, everybody's situation is unique. There's various kinds of dementia, and we've dealt with all kinds.
Well, thank you so much, and I love to hear about the work you've been doing.
Thank you.
So I'm here with Jean. Hi, Jean.
Hello, Melissa.
So tell me a little bit about your experience with dementia as it relates to your family.
Well, it goes back probably last year, maybe October, and my mom, who has pretty much become an invalid, was trying to move on her walker, and she fell. And she had fallen a couple times. About the third time she fell, she could not remember anything. And my daughter and I decided it became a safety thing, so we better take a look at possibly moving into some type of assisted living. And that's when it all kind of started. So it was really kind of an eye-opener, and it was scary because we didn't want anything to happen. If she would have hit her head, it could have been a horrible outcome on that. So we moved on it real quick.
So talk about how, I guess she had some health concerns before, correct? And so was it a doctor that also, did you go to the doctor and did they assist you as well in making the decision?
Well, her doctor actually, didn't quite understand how we could manage with her in the house. And he had suggested it several months before that. And then when everything started to kind of happen in succession, we decided we better do something about it before something really horrible happened.
We have viewers out there who maybe haven't being in a similar situation. What do you think is the biggest part of, moving someone to an assisted living place or getting assistance? What do you think is the challenge or the piece that keeps people from doing that?
Well, one thing is my mother needed to recognize that. It's like, being an alcoholic and realizing you have a drinking problem. So when we told her that this has become a safety issue, she bought into it. And she realized she trusted my judgment, she trusted my daughter's judgment, so it really was a win-win. Didn't take a lot of coercing, it didn't take a lot of trying to convince her to do it. She pretty much understood that, hey, we're at a point now where I can't have them trying to help me. We need bigger and better facilitators and people that are professionally trained to do this.
Do you have any other advice for people out there that are concerned about this, about it, either themselves or a family member that this may happen to?
I would say do your homework, your due diligence, so to speak, and know what you need. That's the number one thing. You need to know what you really need for that person. And it's not a matter of really trying to have to sell it to them. They have to take a look at it and understand that this is going to be the future. You have to understand that this is going to be where you're going to be. And I'm over there almost 4 or 5 times a week to see her. it's a wonderful place for her to go because she's made a lot of friends. The staff is great. And I'm not just blowing smoke. They're great people. They're so nurturing and caring. And I've become really attached to most of them that work there. So there must be a good selection process on who they hire. And that's a good thing.
Well, thank you for coming on and sharing your story, and good luck with everything.
Thank you, Melissa.
Thanks.